start, but if you're ready, we can start. A very warm welcome to this session on NCDs. And just to make you aware that this session is being web streamed, so also a warm welcome to everybody who's joining us via the web. My name is Nicolien Tamsma. I work at DG Santé, DG for Health and Food Safety, in the unit dealing with chronic diseases and the health program. And our colleagues are also working together with the DG RTD on shaping Horizon Europe's health pillar in the future. I will be co-chairing the session.
This is...
This is why we're in the dark. And anyway, sorry about that. I will be co-chairing the session with Christine Berling, who's head of international affairs at the Ministry of Health and Solidarity in France. And we are joined by two really excellent speakers. Mr. Karim Berkouk, I'm okay now, so don't worry. You're deputy head of units, and DG RTDs now have to look new units, I think, for combating diseases. Yeah, so it's new, because you're restructured and working now for people, so that's wonderful. And then Ms. Bente Mikkelsen, who's working at WHO's, she's director of the Division of Non-Communicable Diseases and Promoting Health Through the Life course. They love long sentences. I also at the Commission and the WHO. But anyway, so they will be sharing wisdom with you. But basically, you are the stars of the session, because this today and yesterday and tomorrow is about co-creation. And the Commission is really keen to get your ideas on how to shape the new health research program and also the whole research program. So we hope to leave enough space for you, which we will structure around a couple of questions, being helped by technology, so you can vote on things that you find important. You will find longer bios of all the speakers in your pack, so we don't need to lose time on that. And I think, without further ado, and not losing any more time, I would like to ask Mr. Berkouk to take the floor and tell you something about the consultation that DG RTD is already doing, and hopefully you've already sent in some of your ideas. Thank you, Mr. Berkouk.
Thank you. Hello, can you hear me? Yeah. And before I start, I'll just remind you just a few things, that the three questions that we will discuss today, there will be about 12 minutes per question. We have a limit of time. And then that there is the open consultation that is ongoing and that I will present now. So, we are here to talk about NCDs, and I don't want to speak about the burden, but just one figure. If I say 25,000 deaths in Europe, what do you think is the number of deaths per year, per month, per week? No, it's actually the number of deaths per day that come from NCDs, and it's about 110,000 in the world every day. So we have a huge challenge in front of us. And in order to address this challenge, we have asked in a consultation, which is open until the 4th of October, how can we address this huge challenge? We have divided the question around sub-areas that were identified in the specific program, which means the legal act of Horizon Europe. And we have asked you about these six sub-areas. Basically, if you found them relevant or not. We have had almost 6,000 answers, and most of them, they say that it's either very relevant or relevant, those areas, and it goes between 65% to 75% of relevant and very relevant answers for health issues. And the priority is, according to the statistics, go more towards new technologies, access to innovation, but also effective healthcare system and promotion of health. if you go into the actual free text that you have in the consultation, we try to grasp what was coming out from this consultation. In general, there is a good agreement between the answers and what was proposed, but there are some issues that are much more emphasized in the answers, and one of them is about inequalities across national healthcare system, but also within a country. The research should also target vulnerable populations. A big also emphasis on prevention, which is something that we traditionally do less. Misinformation and facts, providing facts for health-related issue. Of course, also in investment in new technologies, therapies, and in things like drug repurposing. And the last two are more about the involvement of healthcare, patient, and users from the beginning of the of making the priorities. And the last one is about coherent policies, meaning that there are many policies that are not directly health related, but that have an impact on health, and how we can use that for making our policies. And from those areas that you have put forward, we summarize them into three questions that are going to be the questions for today. So the first one will be more on efficient prevention. The second one will be more on the management of patients with NCDs. And the last one will be more about health inequalities. So those are the three questions, and we will leave them one by one on the screen so that you can think about it. At the end of each session, there will be after your question and answers, we will see what is coming out, and we will put it in the Slido type, a question for each, answers for each question, and to see which ones you prioritize. Thank you very much.
Thank you very much, Karim. So yes, we will be using modern technology later to focus on these three key questions and try and distill what you think are the most important elements in answering those questions. So now I'd like to give the floor to Ms. Bente Mikkelsen, who's basically just come in from Copenhagen, more or less, after the regional assembly, and she will share her broader view on current challenges in the field of NCDs. So the floor is yours.
Thank you. Thank you and good morning, Madam Co-Chairs, colleagues, I hope friend of NCDs. It's really a big pleasure for me to be here, and I will set the scene, so to say, from a global and regional WHO perspective. So, as you know, we are blessed with the Sustainable Development Goals. So all the heads of state and governments, they really agreed that we need to reduce premature mortality from NCD with 30% before 2030. This is really good news. Not so good news is, from a global perspective, if we work exactly as we do today, we will never reach that target before 2030. So we have to do things differently. We have to be more bold, probably we have to be more empowering those we are supporting, both individual organizations and politicians. If we look at the burden of disease and also the disabilities from NCD, I hope that you know, but I can tell you that many people don't know, even the politicians, that the big tsunami, if you call it like that, from deaths and disabilities comes from NCD. You see the comparison between injuries and also communicable diseases. If you look at the funding, both domestically and international for NCD, it's almost a reverse way. If we look then on what is happening in the WHO Euro region, meaning the 53 countries from Central Asia, Russian Federation to the EU countries, you can see that on some things we are doing pretty well. If you look at alcohol, it's actually in green, but that is not for the EU countries. They are not making any progress in the reduction of alcohol consumption. So we will have a global and regional consultation actually next week, trying to see how to mobilize, because we are the big consumer of alcohol in the world. If you look at the really red things, and this is very much of a pity and it's not acceptable, is especially on tobacco, and I could see even outside this venue that we see smokers very close to the venue, and I hope that will disappear next time we have a meeting like this, because as you know, this is totally unhealthy. It would never have been accepted if we presented tobacco today. And the other big thing to notify is that we have a big negative development when it comes to obesity, and which will lead to diabetes. So when you look at even children today, in Euro, you have a big increase, and when you look at physical activity, it's actually going the wrong way. So we have approximately 50% of children not being physically active at all in the region. I think it's important to understand that most of these are actually political choices. And there is a constant misconception that it's very costly to invest in NCD. Actually, some people think it is a cost, while it is an investment. So from the NCD global business case done by WHO, you can see that for $1.27 we will be able to tackle NCD and reach the target. So for every dollar, we will have a $7 in return. If you look at the universal health coverage, the access to health systems and services, which is just now ongoing in New York, by the way, and we have a lot of NCD. NCD is actually going up as one of the first priorities on universal health coverage. Again, a political choice, and I will come back to that when we look at the research gaps as well. We have done a lot from WHO with multiple stakeholders and, of course, a lot of support from all the European countries. And we have been able to make a diagnosis. So if you look at this, and if you only look at the bars, you will see that on the political side, we still have to see that governments go to action. There is a big political commitments going through 3 high-level meetings and no universal health coverage. We don't see so far NCD really included into primary health care to universal health coverage benefit packages and so on. We know that we have a huge lack of access to medicines, even the most primitive, all generica. We know that we need capacity, especially on a regulatory basis, and we have a problem with financing. So I will come back a little bit to this, but we need innovative research on how to fund on a domestic level these diseases, and especially the prevention, because as you know, 80% of the healthcare cost is linked to NCDs. And the last one is, of course, the impact on economic market and commercial things. We are not yet fully prepared to both protect our populations, but also to do partnership with all kinds of stakeholders. The good news is we know what is working, and this is really scientific work on the real effective measures. And I will give you one example, and that is on tobacco. So if you look at the best buys, it's called the best buys on tobacco, you can see that we know that if we use the taxation, if we ban the advertisement, if we do front package labeling, and also if we avoid indoor-outdoor smoking, we will be very, very efficient in reducing the negative effects and prevent people from dying. When it comes to cancer, and I was so encouraged by the cancer mission just happening before this session, you know that we have a very high level in Euro, and we have a level of 23.6% of the whole cancer burden. So we need more research. We have a lot of other tools, and I won't go into this. I just want you to know The last years in Euro, we have been working by integrating all these different tools. We have integrated, we have assessed the healthcare system to see how it responds. We have also used cities, kindergartens, schools, and so on. And we have done business cases in countries to see what is the cost of inaction and what is the cost of action. So this resonates very well with all the clusters in the horizon and in the framework we are presented to here, a real call for intersectional action. I have 2 more minutes according to what I'm allowed to speak here. So I will tell you a little bit about some of the main research gaps. And I can hear from the sessions that the data to action is something that comes from all the sessions in this meeting. And we need to use the STEP survey. We need to use all the data that we collect to really prevent these diseases, but also to help us to manage the diseases when they occur. There is already a big investment for the best practices, and we sincerely hope this will continue, because this is really helpful for countries to see what is happening and what is helping, what is failing. Maybe the main, absolutely main important issue for us is the implementation research. And if you look through what we do from implementation research, it's really poor. We had a meeting with a lot of experts in Moscow earlier this year, and it seems like we are struggling to see really the sexiness of the implementation research. I think from policymaker perspective, this is really super important. Let's make this one of the most sexiest topic for research in the next 4 years. Then, of course, integration into primary health care, policy coherence, still a very, very poor area and needs to be researched. As I said, we need to know more about how to manage conflict of interest, to be able to work with all the different stakeholders, and also to see the potential of health literacy. We know a little bit. We are doing a lot now in our region, but there is still a lot to be looked into. Equity and NCD is one of the 4 questions, and my input to this is we need both to see how do the tool actually act to close the inequity, and how do we see new tools and technologies actually threatening a little bit the inequity. So we need to know how is this working. Digital health, for example, can be an example of the latter. Then we have a lot of emerging topics, and I cannot use time to go into that, but just tell you, of course, it's the new tobacco products, it's the new targeting of children through social media advertising, where we don't have regulatory measures. It's, of course, the potential and the opportunity of the digital surveillance and use of big data in many areas. And we can also, again, end up with the implementation research. I think we could group many of these things into the implementation research, and I sincerely hope that this will be a topic picked up by the session. So I will end there. It is time to deliver. I'm sure all of you know. I hope we will do that together. Thank you.
Well, thank you very much indeed for sharing all that wisdom with us. Just to remind you all that actually in New York, the ongoing event on universal health coverage, our Commissioner, Andrew Kaitis, has actually noted that it's important that the EC and WHO complement each other, and that on that, that we're actually doing quite well already, and I think your challenge as regards implementation research fits very nicely with how DG Santé is currently working to help member states roll out best practices. So you're working on best buys, and we're trying to identify best practice and then help member states to implement those practices. Lots going on behind my back, by the way. To implement best practices that have actually worked. So again, there I hope we can complement each other. That being said, I think it's time for the exchange of thoughts, and therefore for my co-chair to lead that debate, but not by thanking both of you for your contribution. So, Christine, please go ahead.
Thank you. Thank you. So my duty, today is really to keep on the time and see that everyone who has a contribution can make it. So we have, 3 questions. The first question is already on. I just want to add, because we were, sitting at the same meeting at these sessions of WHO, committee for the European regions, and what was say, in terms of how to, scale up, in terms of public health actions, there were 3 major points. Was political willingness, and this is very important, but we have it, I think, at national and European level with the new commission being set up and the mission letters, if you've seen, that working across, the countries and working across, the different sectors, and this is key. We have, an example of this One Health approach, etc., so I will not come back to this, but most, and this is my global introduction, is that we need evidence-based, just to support, the public health action. And this is how, research can really contribute and strengthen, what we do, which has an impact on the people. So I'm having this just to keep on the time, not to check my mail while I'm asking the question. So you will have the floor. We have 2 microphones there somewhere. And if someone want to try to answer the first question. So the first question is about, prevention. And there's a key word that I want to draw in is health literacy, and I think you have already used it. And this is really key to have the people handle and be able to be their own actor of their own health. So first questions, we have about 10 minutes, so 1 minute per person who would like to take the floor. You want to have it, and.
Thank you, Mr. Chair. Good morning, citizens. My name is Angelos Harlaftis, Epafos Advisors. We represent a community of universities and laboratories for aging and DNA. A GIRAS community, we call it. So the question is, it's a very good question. The prevention, the Hippocratian is coming again. But the question is that we have an industry in Europe, in the SMEs level, which is on the natural resources, on the Galenian perspective, which was on our medicine sector for a lot of centuries. We have taken the chemical, let's say, direction of the Galenian interpretation. But there are citizens and SMEs which are working near to the nature, and they use these plants or other things for the prevention, and also before the heavy, let's say, entering to the chemical medicine sector. Why aren't we occupied in the research sector with this in order to be regulated?
Okay, so better research into alternative model of cares, and it's already actually included in the WHO list of essential disease, actually. So it's interesting, to step in probably in this field. Other question, please. Answer.
Can I?
Yes.
My name is Wiek van Gilst. I'm representing the European Cardiovascular Research as it has worked in the last years in the EU-supported ERA CVD network. And we have been thinking about the future of reducing the burden of cardiovascular disease, together with the European Society of Cardiology and the European Heart Network. And we have delineated a strategy which is important, we think, because when you mentioned the number of deaths, it's, yes, sure, due to cancer, but the major killer is cardiovascular death. And the perception among the people is that cardiovascular disease has been resolved. We think it's not resolved. It's still a major killer. It's a major loss of participation in society. It's a major loss of quality of life. And we have been very successful in rescuing people who have an acute incident. For myocardial infarction, the death rate has gone 90% lower compared to 30 years ago. But we have created a chronic diseased population. And that needs a new strategy to tackle that.
Okay.
And we have delineated this.
It means that in the documents, you have, expressed also, proposal in terms of research, to help, prevention.
Certainly.
Because there's a lot of, risks that are, transversal to NCDs, and this is.
Yeah, but related to your question of efficient prevention, we are waiting for people to get symptoms, and we think that we use digital technology and other technologies to earlier detect disease.
Thank you. If the microphone could move, more. Okay, right. Sorry, I can't see that far.
Thank you. My name's Alistair Leyland. I'm representing the European Public Health Association. I think this question relates to the issue of equity, because the burden of disease is highest amongst the most disadvantaged groups. So reducing the burden means focusing on those groups.
Yes, sure.
But to do that,
it's the third question.
Yep.
If you could keep your comment for the third question, would be.
It's related to this. To do that, we need improved data.
Okay.
And the data on the social determinants of health don't come from the health sector, they come from other sectors, so joining these things together. The other thing we're missing is good data on multimorbidity, which should be included here, because people are increasingly presenting with more than one disease. It's not diseases in isolation.
So thank you. Your contribution actually deals with the two following questions, actually, but it's very much interlinked, but points are taken anyway. Go ahead.
Good morning, Olivier Arnaud. I am representative of a patient foundation, GDRF, so a huge one. And we think that it's possible to share the knowledge, the network of patients to help also in co-found. So we are a research foundation. It means that we have also priorities planned. So we have already think about what we can do in prevention, but also in other sectors. So we think we already work a lot with the European Commission, but we think that we can share more. So that is one thing we would like to highlight.
That's important. If you could just give the microphone here.
Thank you, Philippe Mouyel. I'm working for GPND, but I'm public health researcher first, and the main problem, it was discussed about the cardiovascular disease. There is two problems. Of course, we have solved some of the questions, but the primary preventions, you should know that there are still about 1/3 of the heart attack who died immediately. That's called sudden death, and the only way to tackle that is to develop primary prevention. That's what you say is about tobacco, about alcoholism, about obesity, and others. We have the same type of approach for other diseases, which are accelerated by cardiovascular disease, just like neurodegenerative disease. So where we need to tackle tobacco consumption, alcohol consumption, and obesity. So we know what to do, I think, now, but we don't know how to do it. And if we have to focus research now, it should be in how to do this. And this should imply not only the researchers, because researchers consider that they have solved the problem, just stop smoking. But the question is not as simple as that, and we need the politicians, and as you mentioned very well, if you raise the taxes, if you ban it from the workplaces and the public places, it has great effect, as shown already studies in Italy and others, and in France even. So I think if we need innovation there, it's in how to apply what we already know in that field of research.
I have a question. Contribution actually put also in writing, so you will have it in the system. I'm an academic, and I used to be a regulator of pharmaceuticals until end of March. I think what should be prioritized for efficient prevention is to invest in a healthy future generation, and this is a different connotation in advanced countries like Europe, a region like Europe, or in low-income countries. And we know that, yes, we can leverage media, we can leverage mothers' networks, we can leverage schools' activities. So I think these are where data can be actually accrued very quickly. We have to use crowdfunding to have a quick response on what are the social determinants or the health determinants which have a major impact on the child, on the teenagers. And when it comes to, so we have to bridge the gap, because we know already what are the predictors of bad health outcomes in adulthood. We know that. A lot of research has been done. What is missing is the implementation and the how. And I think there is a big diversity, what needs to be done in Europe, for example, and what we need for low and medium income countries. We know that tobacco is having a hard time in Europe, but we know tobacco is given for free in low-income countries. And the same applies to alcohol. So I think Europe can be leading, making a model for Europe, but I think we should work very closely with the WHO, because the avalanche with the immigration and movement of people will come from other countries.
Yeah, we do actually have, close collaboration with WHO. In terms of tobacco control, we have actually, a whole set of measures, public health measures, but we see, new challenges, and in particular the vaping, within youngest, who start, will start entering into smoking through, this vaping,
but this is why
model, which where, at the onset used to, or forcing to be used to help, people quit smoking. So it's very, just to point out that it's a very evolving, ground, public health, and we really have, to be, to have, this research, anticipating this.
Yes, one thing I do, sorry, is very quickly summarize crowdsourcing data.
We have picked up, your point.
Yes,
crowdsourcing
plus
and
primary care, because it's an untapped resource. Thank you.
Yes. Right. Pardon.
Yes, thank you very much. I'm Alice Dorlesta. I represent the Aranet neuron that deals with neurological and psychiatric diseases mainly. What I would like to stress, and we heard this from several areas already, that it is not the prevention. We need to differentiate. Prevention is different in different areas of diseases. It's different in low-income countries and in our country, European countries. So there needs to be some kind of differentiation. We have lumped together non-communicable diseases already. If we lump together everything else, this will not become we will not come to an efficient outcome, I'm afraid.
Okay. So who has a microphone now? Go.
Hello. Thomas Dubois from the French National Cancer Institute. I'll be very quick. I think we should invest more in the risk factors approaches in terms of research. And for the innovation part, I think maybe we should further offer opportunities to develop tools that target populations related to those risk factors.
Just like vaccination, for example, and no one mentioned this yet, I think, and it's very important, in terms of prevention, and still a challenging issue, actually. Yes, please.
Yes, I am Eusebio Gainza from BioCaralty. Caralty Group is a private healthcare system. And in my opinion, in the prevention action, the alimentation is necessary to comment two aspects. One is the safety food, food without pollution, food without problems, with equilibrated lipids, and also the metabolization of the food, the microbiome, and these activities for the prevention are very important. And also to control that and do activity, of course.
Yes, so nutrition, research into nutrition and the thing. We're close to the end of the first session. If there's, well, allez, Marie-Lise and the lady, and then we stop.
Marie-Lise Corbex from WHO. Just a point about the tendency we see, and we have a big meeting on that at WHO, on the screening health check practices which are not evidence-based, for which more research is needed. We realize that in the Europe region, countries are implementing all kinds of health check, or also companies, testing your urine, your heart, your belly to find whatever lump. And more and more happen because of commercial determinants for that, and pushing from also private companies. So there is a need for research on that. Yeah. And second point, why also people are diagnosed so late for many NCDs. We should not only put the blame on the victim, on the health literacy of people, but also the health literacy of our doctor. A recent study on 4,000 people with cancer found out that 32% of them were diagnosed with something else than their cancer at first. So we also need to do more research on what is happening, why we have late diagnosis, and on the health system part.
Yeah, and maybe you will be the last.
Okay. Yeah, I think we need to move on.
One last comment and then we stop.
Okay.
Is it? Okay.
I was just giving a floor. Hi. Anka Toma Friedlander from the Smoke Free Partnership. I work in tobacco control. And to your question, my answer or my proposed answer would be more on the policy and implementation research side, especially, and perhaps less on the innovation side, because there's a lot of best practices and translational research on how we can transfer best practices in prevention policies, population level intervention, risk factors, these things have been mentioned, that would be quite helpful.
Okay, thank you. So, Nicoline,
yes,
to wrap up quickly.
I've been given the ungrateful task of trying to summarize what you've just already shared, which is a lot, into 3 questions. So apologies if you feel mishandled. Everything you have said, we will, of course, incorporate and take along. So just to try and fix this into 3 main issues, and my colleagues from RTD are in the back of the room trying to put this in a technology app that you can vote for. I think what I took from you is that we need to strike the right balance between, on the one hand, focused preventive approaches, because quite a lot of you have mentioned specific diseases or conditions. So between focused preventive approaches, but on the other hand, also life course approaches, because we are moving through life. So there's a tension there. We need to make sure they both get focus. I also heard and also taking Bente Mikkelson's invitation, we need to look more at hurdles and facilitating factors for implementation, and that could be political ones as well. So it doesn't always have to be technical ones or biomedical ones or medical ones, but also political science, etc., etc. How can we make sure we implement what we know? So that would be the second one, hurdles and facilitators for implementation. And the third one, which is a little bit related to, I think, our third question, is that we need to be more aware our key clients are people in the lower socio-economic strata with multi-morbidity. So focus on the key clients of the system, which are so lower socioeconomic groups, lower educated groups with multimorbidity. They should be the norm rather than the exclusion. So I'm sorry if that still sounds rather vague, and I hope my colleagues can work with that. And then we move on to the second question.
Second questions, and the second question deals with management of patients and then the organization of care. So we have, mentioned implementation research and the focus and how, the patient should be dealt with. And I just want to draw, here, that outcome research is also key because, it's really the impact of the process and the organization of the system, to the patients and to the well-being of the people. So open the floor now, and again we have about 10 minutes. So who is first to take? Yeah, thank you.
Thank you. My name is Annika Eberstein. I represent COSIA, Association of Medical Device Manufacturers. So for us, one trend that should be researched here is, of course, the use of digital technologies in supporting patients to manage their health. And there could be 2 key questions. The first one is how to better personalize tools for patients together with patients while still providing tools at economic scale. And the second one is how can we also use tools to improve the communication between patients, healthcare professionals, and informer carers. I can go on, but you want it short.
Sure. No, this is a key approach, and what we have to facilitate is entry of the patient into the system, and those tools may help or facilitate. The patient navigation as well. This is all key. Elements and key point. Another contribution here, yes, please.
Geert van der Heijden, Amsterdam, Public Health and Oral Health. I think accessibility and affordability are two major issues in equity in NCDs. So to capitalize on what we know on this, we should divert from the more biomedical approach in helping these people in the social environment.
Okay, thank you. Next.
I am Francesco De Lorenzo. I'm president of European Cancer Patient Coalition. We feel that cancer is one of the major diseases in non-communicable disease, but I have to say that within this area, patient organizations are completely forgotten. And also, the United Nations in this resolution was stating the need of communication and interaction to get patient organizations to have a major role in these things. We are active within the cancer, but we are completely forgotten. We tried also in the Alliance to let them knowing that the cancer patient organization needs to have a role in this. I wonder whether you feel that really cancer patients should follow what the United Nations is recommending or not.
I don't think I have to answer these questions, but the role of patient organization is key, but it's also challenging as well because, for example, on vaccination, it's representation of citizens, so we need to find the right representative. In cancer control, it's easier. On entend encore.
My point, Philippe Amouyel from GPND, Neurodegenerative Disease Research. It's a bit of what I've been said in this last intervention, that the trends that we should capitalize in the management of patients where there's no real management and no real treatment is really to include the patients, the families, the carers in the choice of the different actions and type of management. I think this is very important. We have done that in GPND with a public patient involvement. We have that to the researchers who apply to a court, just to see how do they have implied the patients and their families in. And I think what is very important is to have in all of the different boards, scientific advisory boards, things like that, patients. Because their point of view is much more different. They are more risky because they have urgent questions and they may change the trends and the decision of choice of a call or an element. So I think having patients, through individual patients, through patient organizations, through lay groups, whatever, is, I think, from that point of view, very important now.
Yes, yes. So really the social challenge into, a global approach to the patients, including the family and the helpers. Yes, please. Oh. No, says someone on the back first.
Hi, David Fenner. I represent Saxony-Anhalt, one of the German regions. We've had a couple of comments already about the use of digital technologies. A lot of that is already in the program document itself. One other issue which I think requires a certain amount of extra research in addition to this digital technology aspect is the kind of use and interaction of interprofessional healthcare teams. So how do nurses interact with not just with the patients themselves, but also with doctors, with clinical staff, etc. Just to give it kind of a more holistic approach that doesn't just focus on the use of tech. And I think this goes together with the whole debate that we've had already about implementation research, that we need more kind of focus on the ground, not just on the use of digital tech, but what the impact of it actually is on the ground.
It's very much linked, with the outcome research, actually, the whole of the organization and how the process also impact, actually, more than implementation research. I don't know, if you
Hello, I'm Dr. Malaina from the Madrid Health Service, and I think the future of the management of patients should be done taking in consideration not only the burden of disease, but also the quality of life of patients. And in that sense, I think it may be good to think about mental health, also musculoskeletal disease, and other diseases that are a little bit forgotten, mainly because the innovation is too focused in commercialization, in spin-offs, and in getting a market. And in this kind of research, we miss this, and I think we should invest more in procedures, in primary care, healthcare systems, and social changes.
It's really research, across different sectors. Yesterday, we had them in a session on back to work issues and the working environment and the impact on health, etc. It goes very much with what you were saying. It's more a holistic and transversal approach, health into the different sectors. So it's key also, for the management. Here first.
I just wanted to add to what the Saxon representative said. It's true, interact with different actors around the patient with non-communicable disease, but it would be very useful to have research on models for multidisciplinary approach to patient. It's not just the primary care. If the doctor is confronted with a chronic patient, it's always the same story. So we need maybe to see which models are available already in some member states and sort of learn from best practices. This is something which is difficult to conduct in a standardized way, but will tell what kind of disciplines are required. Of course, text has been mentioned, nutrition has been mentioned, but they are never sitting together.
No, but it's a centered approach. That we're trying.
Exactly.
to implement and with this quality access, etc., facilitating access. A lot of points have been already said, but the question is really in terms of what research should be done. I think one last question, and we.
Okay.
Yeah, it's.
Yes, thank you.
Yes.
It would be me. Dorota Sienkiewicz, EuroHealthNet. I had a kind of question or comment related to the comment made earlier. We've been working a lot on the future of work agenda at the EU level, and that's exactly what has been mentioned. Because at the moment, I'm not sure the future of work agenda actually deals properly with the psychosocial factors of patients with NCDs. Is ready to reintegrate people back to work. Also, questions related to getting people back to work after a long-term unemployment, so people with NCDs. And the last thing, we also have been working a lot on the digital health literacy and seeing that the digital transformation of health and society as large grows quite quickly. This, in our opinion, should also be taken adequately into account.
Thank you.
Yeah.
There's no... Oh, yes.
Shall I summarize?
Because till one, and then we
okay.
summarize. Yep. Yes,
so,
go
hi,
ahead.
I'm Joanna Lemig from the Champalimo Foundation. I would like to stress a bit of what has been said in terms also, I believe the management of patients with NCDs links with the management of the disease itself, and how we should also invest in terms of research in comparing the different treatment options available, not only on the outcomes of the disease, but also on the economic burden it has on the countries, because more and more you see in different countries, for instance in Portugal, raising the issues of the costs and not investment for the governments to make these medicines available in terms of the equity and so on and so forth.
Yes, and sustainability of health system is also, key in the sustainability agenda. Your turn, please.
Yeah, sorry to be so, we really have to keep with time. Again, thank you very much for all of that. My attempt to cluster this into three elements is to say what we are looking for is research that looks at, in a broad sense, access, affordability, user-friendliness of the whole system. That could include the user-friendlessness of technology, but it could also be the user-friendlessness of other elements of the system. And it could include health literacy work, because that's obviously about using the system. So that would be one point. Then I've heard research that looks across sectors, going back again about the fact that many patients have more than one disease. But if we work across sectors, if we really look at intersectoral approaches, that could also include the work elements. Because people with chronic diseases, they work or want to return to work. We don't really see that as part of the health system, but it is very much part of the life of patients. So that's two, across sectors and life elements almost. The third element, I think, is research into, or incorporating patients' views and patients' empowerment, patients' knowledge in the research that we're doing. So bottom-up approaches, but also using research that has been generated through patients, anyway, including the patient perspective in a broad sense. So that was my attempt to summarize this into 3 bits.
Okay, so we move it to the third questions and say how, research, should address, health inequalities. This is really, very, topical. So we really have, to address the social challenge of health inequities and try to reach out the underserved population or, the population in situation of vulnerability. So I just open the floor now. To all your comments and proposal.
My name is Susanne Laxer from the European Heart Network. My question is indirectly related to addressing health inequalities. One of the issues that you put up in the very beginning of it was policy coherence, and I would like to go back to that because in the EU, of course, there are a number of policy areas, and several of these may have a negative impact on health, and they may have an even worse impact on those who are more socially deprived or less educated. So I think that we think, I should say, that there should be a research on how could we develop the best health impact assessment system that the European Union could actually use on its own policies to operationalize the Article 168 of the treaty.
Yeah,
thank you.
Sure. I think it's work in progress, and we're doing this. It's many frame program, but you're right. This is key issue and key research area actually that we have to enter. I think yes, colleague here.
Hi, Tutte Schmidt, European Observatory on Health Systems and Policies from Brussels. We should address universal health coverage, that's for sure, but we also need to go beyond healthcare service delivery, and we also need to make for the people healthy choice an easy choice. So, for example, making fruits and vegetables available for everybody. And we also need to cover health in all policies. So it's also related to the second question.
But even in countries where you have services, health services with free access, you see that you still have inequity. So you really have to reach out the people. And so some area of research would be how to better reach out the people. So we provided this with the healthcare plan and say, just to be able to advance on inequalities, we will reach out these communities, this kind of people, this kind of. So this is really. The research are very important. Yes.
I think a major part is in this also to try to give social benefits to these patients, because also in cancer now they are surviving and they need to go back to work, and I think a member state to try to make facilitation to go back. Otherwise, this patient will live on inability and disability pension. I think this is a major part of the mission, to look also to social part, not only to research and development.
Yeah. There inside, a joint action called, CODIS Plus. There is some initiatives going on facilitating back to work. For cancer patients, back to work issues for cancer patients. So we have, example working, and on the session yesterday, they were mentioned. So, but more research on the health environment, the impact, the work environment, etc., is really, important. Not to create new inequalities due to, disease that has been cured. Yes, we got your point. Yes.
Last point, I also think that we have to avoid maybe among different communities the technological gap. Try to perform or develop sustainable, affordable and cheap technology so that we can have different communities that are not able to apply certain treatments or certain technologies to the diseases. Thank you very much.
Thank you. Yes.
Robert Peterson, I'm from Roskilde University in Denmark. I was at a session yesterday on social transformations, and I think when we're talking about inequalities, maybe not necessarily just health inequalities, it's really important to think about what sort of system we operate in. And I think sometimes the elephant in the room that we don't want to talk about is the distribution of wealth, resources, not just in Europe, in countries, but also globally. So I think when we're talking about health inequalities and a more systemic approach to how we deal with that, we should keep in consideration what's the goal of what we're doing. Is it happiness or is it GDP?
No, it's an important point, but in terms of inequalities and health inequality, we can act, at the health level also. In the environment, area, for example, it's not, the actions are not really in the portfolio of health. We are just a consequence of what we are breathing, eating, whatever. But in health inequality, we can really target, specific population, help, so we have done something also to address this specific inequalities are the consequence of many factors, and I agree with you. We have to act. Transversal across sectors. This is very important. I agree. Yes, please.
Many of the actions to reduce health inequalities will come from outside the health sector. So it's recognizing that, looking at the impact of welfare changes, of housing, of anything else that's going on, and putting proper money into the evaluation of these so that other countries can learn from variation between countries and changes within countries on their impact on health inequalities.
C'est fini? Yeah?
Last one, yeah.
No, okay, so wrap up.
Okay. Yeah. Let's see. I think want to go. So one issue that we should develop more is to do with health impact assessment, health inequality impact assessment. Develop new methods, but also incorporate it maybe into the research proposals. So they want to take that on board with whatever research we're going to set up on as regards health. So impact assessment, health equity impact assessment. The second element, I think, would be to, from a health perspective, think about funding research that looks at other sector policies and the impact on health. So again, it has to do with health impact, but it's a kind of research that maybe you might not at the first sight expect health to fund, but because other social policies have such impact. So it would be research that looks at other policies. And the third one, let me see, is to do with, I think, research goes a little bit, zooms in a bit more, synergies between social policies and health policies, social interventions and health outcomes. So it's a little bit close to the first one, but yeah, I think it should be a separate element. So I hope that's all right. So if my colleagues...
I thought that before we close the session, we had an additional request if we had forgotten anything, or if you have one. Is it?
Now we're going to vote.
Yes. Oh, there's a vote. There's a vote going on.
I think our colleagues should have a technology ready for you for your app, but don't know whether Karim wants to lead that.
Okay.
So you should get your mobiles ready. And already wonderful work from the colleagues from RTD to manage whatever I've been waffling and summarizing to put that into sensible sentences that you can vote for.
Okay.
Karim, you want to do this? Yeah?
Okay, so the question is, following the discussion today, the main identified actions to enhance efficient prevention for decreasing the burden of non-communicable diseases in Europe and globally are below. Please prioritize.
Prevention, implementation.
Want to move to the second question?
Yeah.
Okay, so the answer is majority for focusing on better balance between preventive approaches over the life course, and almost at the same level as implementation research and how to use implementation research and policies to actually reach the people. We now go to the second question. Okay, so sorry, that was the second question is the same, but here it's about the management of non-communicable diseases.
Yeah, want to move to the third one?
Yeah, we can move to the third one. So it's the same, give your priorities, but for inequalities. Okay. So it's clearly moving towards synergies between social and health policies, followed by the health inequality impact assessment, and at the end it's more funding research in other areas than health. Okay, we will keep that for us. You will have a next question on whether we have missed something. But there you don't have to answer now. This is free text that you can provide to us whenever you want. And you can do it whenever you want so that we get the feedback. I just remind you that from 12 until 3, if you have any further question or you want to provide further elements for the future priorities, there is a health booth. I think it's number 9, where you can go and people will be there to take your suggestion if you didn't have time.
Okay. Well, I think that brings us quite nicely to 11:45. I want to thank you all very much for your input. Please be aware, I mean, you can still give all your ideas, and the consultation is still open. So the Commission is really interested to learn more from you and what you think is important, so we can really make a difference with the new research program. So thank you all, and thank you very much to my co-chair and to the speakers. I hope you found it an inspiring session, and I wish you good lunch and a good session this afternoon. Thank you.